14 days before stroke, your body gives this warning. Every 40 seconds, someone in the United States suffers a stroke. By the time this video ends, dozens of families will have their lives changed forever. But here's what most people don't realize. Your brain often sends out desperate warning signals as early as 2 weeks before a major stroke occurs. These signs are not random. They are your brain's way of asking for help before blood flow is cut off and permanent damage is done. Yet too often these warnings are dismissed as fatigue, stress, or just a part of getting older. Today, we're going to uncover the critical early warning signs of stroke that can appear up to 14 days before the event. By recognizing these signs, you or someone you love could take action in time to prevent tragedy. If you're new here, welcome to your health journey. We share life-saving knowledge that empowers you to protect yourself and your family. Don't forget to hit that like button, subscribe, and let us know in the comments where you're watching from. We love hearing from our global health community. Please remember, this video is for informational purposes only and not a substitute for medical advice. If you notice any of these symptoms, seek immediate medical evaluation. Now, let's explore the signs your body may give you 14 days before a stroke. The first sign is the sentinel headache. Imagine waking up with a headache unlike any you've had before. It's not a normal tension headache, not even a migraine. It feels different, more intense, and it refuses to go away. Research published in the Journal of Headache and Pain shows that nearly 15% of stroke patients reported this type of unusual headache in the days leading up to their stroke. What makes it so alarming is its persistence and unfamiliar character. This isn't the kind of pain that eases with rest or medication. It often begins suddenly, builds up, and lingers in a way that feels unsettling. If you experience a new, intense headache that seems off compared to your usual patterns, consider it a serious warning. The second sign is a transient ischemic attack, or TIA. These are sometimes called mini-strokes, but don't let the name fool you. A TIA happens when blood flow to part of the brain is briefly blocked, causing temporary stroke-like symptoms. You might notice sudden facial drooping, weakness in one arm, or slurred speech that disappears within minutes or hours. Many people ignore these episodes because they go away quickly. But this is exactly what makes TIAs so dangerous. According to the American Heart Association, about 43% of people who suffer a major stroke experienced a TIA within the week before it happened. TIAs are not harmless. They are red alert warnings. If you or someone around you experiences sudden neurological symptoms, even if they vanish, treat it as a medical emergency. The third sign is dizziness or balance problems. Have you ever felt like the room was spinning, or found yourself stumbling without any clear reason? While occasional dizziness can happen to anyone, persistent or sudden balance issues may signal vascular trouble in the brain. The brain regions responsible for balance are highly sensitive to blood flow changes. When circulation is compromised, these areas begin to malfunction, causing unsteadiness and vertigo. People often dismiss this symptom as inner ear problems, medication side effects, or simply aging. But if dizziness appears suddenly, lingers, or is accompanied by other neurological changes, it could be a sign that your brain's blood supply is under threat. The fourth sign is vision changes. Your eyes are not just windows to the world. They are directly connected to your brain's health. Blurred sight, double vision, or sudden vision loss in one or both eyes can all be early warnings of stroke. Some people report seeing flashing lights, blind spots, or difficulty judging distances. Others experience intermittent double vision that comes and goes. These issues may be easy to brush off as eye strain or fatigue. But medical research shows that visual disturbances often precede strokes, especially when arteries supplying the occipital lobe become narrowed or blocked. If your vision suddenly shifts in ways you can't explain, take it seriously. The fifth sign is speech difficulties. Imagine trying to speak, but your words come out slurred or jumbled. Or perhaps you know exactly what you want to say, but you can't find the right words. Speech relies on complex coordination between brain regions. When blood flow to these areas is disrupted, even briefly, your ability to communicate suffers. Some people also report difficulty understanding language, as though others are speaking a foreign tongue. These episodes might last only minutes, but they should never be ignored. Sudden problems with speech or comprehension are among the clearest early signs that a stroke may be coming. The sixth sign is weakness or numbness on one side of the body. This is one of the most classic stroke warnings. You might reach for your coffee and realize your grip feels weak, or notice that one leg feels heavier when climbing stairs. Sometimes the numbness feels like pins and needles. Other times, it's a loss of sensation altogether. The key detail is that it usually affects only one side: the right arm, the left leg, or one side of the face. This happens because strokes typically affect one hemisphere of the brain, which controls the opposite side of the body. Even if the weakness comes and goes, it's a red flag that blood flow to motor areas of the brain is being compromised. The seventh sign is unusual fatigue or confusion. Many stroke survivors recall feeling drained or mentally foggy in the days before their event. This isn't the ordinary tiredness of a busy week. It's a deeper, unexplainable exhaustion that doesn't improve with rest. Some people also report difficulty concentrating, reduced motivation, or a sense that everyday tasks suddenly feel overwhelming. Your brain consumes enormous amounts of energy, and when blood supply falters, it struggles to function normally. That struggle often manifests as fatigue, confusion, or sudden lapses in memory. The eighth sign is sudden hearing problems or ringing in the ears. While less common, studies have documented that sudden hearing loss or tinnitus can appear before certain types of strokes, particularly those involving the posterior circulation of the brain. The inner ear and auditory processing areas are supplied by delicate blood vessels. When these vessels are compromised, your hearing may be affected. If you wake up one morning with unexplained hearing loss in one ear, or develop persistent ringing without any clear cause, it may not just be an ear problem. It could be your brain warning you of vascular trouble. The ninth sign is nausea or vomiting without an obvious cause. While many people associate nausea with food poisoning or stomach flu, sudden unexplained nausea can also signal a stroke. This is especially true if it occurs alongside dizziness, headache, or other neurological symptoms. The areas of the brain that control balance and nausea are closely linked, and when blood flow is disrupted, both functions can be affected. If you or someone around you experiences sudden vomiting without any clear reason, pay attention. When combined with other symptoms, it may be more than just a stomach issue. The 10th sign is seizures, or temporary loss of consciousness. In some cases, the brain's electrical activity becomes disrupted before a stroke fully sets in. This can result in brief seizures, fainting spells, or episodes of sudden collapse. These events are frightening, but they are also crucial warnings. They indicate that parts of the brain are not receiving adequate oxygen and nutrients. While seizures can have many causes, when they appear suddenly in an adult with cardiovascular risk factors, stroke should always be considered a possibility. Together, these signs form a pattern that can save lives if recognized early. A new, unusual headache, a transient ischemic attack, dizziness, vision changes, speech difficulties, weakness, fatigue, hearing problems, nausea, or sudden seizures. All of these may appear up to 14 days before a stroke. The tragedy is that many people ignore these warnings, only realizing their importance after it's too late. But you don't have to be one of them. By learning the signs, you can take action, seek help, and prevent disaster. If you notice any of these symptoms in yourself or a loved one, don't wait. Call emergency services immediately. Stroke treatment is most effective when it begins quickly, and every minute counts. Remember the acronym FAST: face drooping, arm weakness, speech difficulty, time to call emergency services. But now you also know the subtler signs that may appear in the days or weeks before a stroke. Your brain is constantly working to keep you alive, and it sends signals when something is wrong. The question is, will you listen? Thank you for taking the time to learn these critical warnings. If you found this information helpful, type "helpful" in the comments below. Don't forget to like this video, share it with friends and family, and subscribe for more life-saving health insights. Knowledge is power, and by sharing it, you may save a life. Stay vigilant, stay healthy, and remember, when it comes to stroke, every moment matters.